Dr. Neeta, who has done her MD FRCP, and she's a diabetologist and a bariatric physician from Belgaum Diabetes Center and the Children's Diabetes Centers and Weight Watch Obesity Centers. She's a professor and head of the Department of Medicines of Dental Medical College. She's associate professor of medicine at USM KLE International Medical Program. Today, she's going to talk about the poster presentation, how exactly it will be there, and what are the orator skills, what will be really dealt across. Over to you, ma'am, and maybe you can start your plan.
Yeah, thank you. Thank you so much, Dr. Suman. And at the outset, it gives me immense pleasure to be here on this forum, especially because being one of the founder members of KRSSDI and a past chairman of the KRSSDI, it is amazing how every one of you have taken it from strength to strength and brought it to such a high level. And that is really, really lovely to see. And thank you very much for giving me this opportunity to be here, to be speaking about oratory skills, especially in the poster presentation space. It of course applies to oratory skills elsewhere also, and that is what I'm going to focus on today. I do not have any slides to project, but definitely I would like to give some tips because I have been in, let me say, the business of lecturing and speaking for the last 30 years. And with that, what I have gathered over the years is something that I'm going to share with you today. When it comes to oratory skills, whether it is for poster or otherwise, two very important things come to mind. Number one is the content of your talk. That means the academic content of your talk. And second is language skills. Both of these together are what comprise oratory skills. And trust me, both of these skills do not come overnight. It's not, I have a preparation tomorrow, so I look at my content, be thorough with it, and I make a great presentation tomorrow. That's not what oratory skills is about. Oratory skills is about what you have gathered over the years, both in terms of content as well as language. So when it comes to content, you have to have a thorough knowledge of your subject, not just what you're going to present, but the cross-referencing, the other studies that are connected with it, the other issues that are connected with it, because you don't know what questions will be thrown at you. So you need to be fully prepared even for those. And that is how it is important to have content skill, not just with respect to that one poster that you're presenting. When it comes to language skill, it's a lifetime of learning, a lifetime of reading, a lifetime of listening to the right things. Whether you like it or not, the medium that we all use here and internationally is English, which simply means that your English, it need not be flowery, but it needs to be grammatically correct. And second is the fluency. It is very frustrating for a listener to keep hearing about words like okay, and it is like, you understand me, right? You know, these kind of fillers which come in take away from the fluency of a talk. So the words have to flow like a river. They need not be high-flying words. The vocabulary need not be great, but it has to flow. And for this flow, practice is important. And as you saw from Dr. Shekhar about the 4 P's, the one P that struck me was the word performance. Actually, every lecture, every presentation in itself is a performance. And for performance, practice is required. And that is why I said the content is important, and that content doesn't come overnight. Coming to your posters now, because that is the focus of attention for today. Remember that when you are presenting a poster, you are usually standing by the side, you know, there's a standing, you're standing there, and you are going to be presenting it. Most of the times, other than in some foreign conferences and some very big conferences, you will not have a microphone. So you need to really speak up, speak loud and clear. That is one of the first tips that I would give you when you're talking about a poster presentation. Remember that there are plenty of posters in one particular hall. There are people who are coming around looking at all the posters. What makes one person be drawn to a particular poster and just walk past some other poster? If someone sees you talking very authoritatively at one particular poster, immediately the attention is drawn to that side, and that person will actually come over to see what you are talking about. And that's why you have to be loud and clear. So that is number one. As I said earlier, your words have to be simple but elegant and very, very fluent. There is absolutely no room for hesitation, no room for gaps, unnecessary pauses. These should not be there in a presentation because they make the presentation very boring, and immediately attention is taken away from you and your presentation. So that is very, very important. If possible, if the subject warrants, some amount of humor can be added here and there. You'll have to decide beforehand what kind of humor you're going to be using. The other thing that I would like to tell you is that when you are at your stand, where you're standing in front of the poster, your manner has to be very easy. If you're very stiff, you tend to be very serious. If you're very serious, you will be boring. And if you're very boring, the fluency is also not there. And therefore, you have to have an easy manner. You have to be relaxed, but not casual. If you're too casual, you're not taken seriously. So it has to be a good balance of being relaxed, but yet formal and not casual. Now, coming to the actual poster presentation per se, let me divide it into two parts. One is if you are presenting to an evaluator, a judge who has come to judge your poster. And the second part will be for the audience, people who just come in to view posters. So there'll be a subtle difference between the two. So let's come to where a judge is coming in and he or she is going to evaluate your poster. Usually they come in a group of around 4 or 5 people, and they're very formal looking. It's like giving a viva voce examination. They come with a pad and a pen and they ask you questions and things like that. And they may come to where you are standing. So how do you present a poster to an evaluator? The first thing is mention your title clearly. Don't expect them to stand there and read your title. You are making a short presentation, very, very short presentation. Give yourself just about 3 to 4 minutes. You don't have more than that because they may just move on. They have many posters to evaluate. So mention your title very clearly and make sure that it has a catchy line in the beginning, in the sense that the gist of your presentation, or rather the topic that you're going to be speaking in 1 or 2 words, has to come first, and then you say it's a cross-sectional, comparative, whatever. So diabetes mellitus, if it is there, or if it is obesity, or it is GLP-1 analog and weight loss, mention that first and then your actual title, so they know what you're going to be speaking about. Next, after that, instead of reading from your poster, that's the worst thing one can do. You keep looking back at your poster. You should know the poster like the back of your hand, in fact. You should not be having to keep looking at your poster. But before looking at the poster, you should be able to talk extempore and tell them, actually, it is rehearsed. It's not extempore. But even though rehearsed, it should come out very easily. In 1 minute, you need to give a summary of what you're going to be speaking. Literally in maybe 30 or 45 seconds, you just give a summary, the gist of it. The reason I'm saying this is that they may interrupt you right when you are doing maybe your results or your conclusions and say, okay, that's fine, and leave. So you do not get the chance to actually complete everything that you wanted to say. And the meat of your talk might, if you've kept it for the end, you may never get the chance to speak it. And therefore, in 1 minute summary, if you tell them everything, at least you have already got across what you wanted to say. So a quick 1 minute summary of everything that you're going to say has to be there. Please remember, before I even go further, poster presentations, oral presentations of a research paper, they are far, far more difficult than a 30-minute talk. The more time that you have to speak, the easier it is, because you can elaborate and convince and do everything. But to pare it down to just 5 minutes is extremely difficult. Your choice of words has to be very precise. There is no room for making a mistake here. So that is the one thing, that 1 minute summary becomes very, very important. Next, if you have your own laser pointer, it becomes very easy because obviously they're not going to read your entire poster. So if you have a laser pointer, and direct them directly to a point that you want them to focus on, the laser pointer really helps. So you direct them rather than them just floundering around and looking at everything at one time and trying to make sense of it. If you actually guide them towards where you want them to go, it becomes very easy. If you have your own laser pointer, and it becomes then very easy. And as I said, please do not read. Give it in a gist, just speak to them as if in a conversation. And as I said, keep it really, really short. Do not elaborate. Talk only the most important points and keep it very, very short. The reason is that if they really like your work, you need to give them time to ask questions to you. If they ask questions to you, you get that much more time to answer, because they will stop and listen to your answers. They may stop you in the middle of your presentation, but they will always wait till you complete an answer. So give them a chance to ask you questions, and that's why you need to be really short. And once they ask you a question, make it very, very clear that your answers must be crisp and to the point. If you start elaborating, again, they're always short of time. There are many posters to cover, and then they will just move on, and your answer will just be left in the air. So your presentation has to be crisp, but your answers to their queries have to be equally crisp, short, and fluent. So that is about how you present it to an evaluator. Of course, you have the knowledge, you have done the study, you know everything about it. It's very tempting to start elaborating upon it, but don't give in to that temptation. For example, if you used a very sophisticated machine and you start going into the depths of that machine and how this machine is superior to some other machine, you will lose all your time over there. It's very tempting because it's your work, it's your passion, your baby, and it's very tempting to elaborate a lot upon it, but resist that temptation and stick to what is most important so that you get across all your points in that short time. And that is my take on whatever posters I have presented internationally. This is what the knowledge I have gathered about how a poster should be presented to an evaluator. Next comes about the presentation to audiences who are coming across. Remember, do not take audiences or an audience lightly. You never know what kind of collaboration your presentation can attract, because you don't know who your audience is. You don't know whether they're from the pharma. You don't know whether they are avid researchers of the same field. You do not know if they're your rivals. You do not know anything. They're just there because in a hall, you know who's there. But when they come to see posters, you don't know who's coming. And it is a chance to network. It is a chance to get across your work, to get more work. So do not underestimate the audience, and talk to each member of the audience. Anyone who comes across to see your poster, treat them with the utmost respect and present it in the same way as you would to an evaluator almost, because you may impress upon them something and something else may come out of it and open up many more opportunities. That is how I would look at it. So you may start with a teaser question with an audience. Like, for example, what is the incidence of obesity in children in your part of the world or in the region where you are? So if so it becomes more like a conversation. So you can start it off with like a question, asking them a question, and then you start about talking to them why you took this up, depending upon how much interest is shown, why you took it up, because there are people who are clinically oriented. The other thing that you should remember is that people who come to see posters, or most people who attend conferences, are not researchers. You are a researcher, that's why your poster is up there. But people who are coming there are not researchers. They are mostly clinically oriented people. They are looking to see how this is going to be applicable in their clinic. So you should be a little more clinically oriented, especially where it is applicable to them. And maybe you should point that out right in the beginning to hold their interest about how this is going to help your patient. So if you can tell that to them in a nutshell in that first 1 minute, this is not what you would tell an evaluator. An evaluator is research oriented. Audience who has just come to see may not be research oriented. So to that person, your approach may be slightly different. You will have to tell him what is the applicability where his patients are concerned. The other thing is that you have to make it very simple for them. For you, this is your research. You know every little detail about it. You cannot assume that your audience has the same level of interest in this particular topic as you have. So he may not have all the knowledge about it. Something that you take for granted, the person in front of you may not know it. So you have to actually, dumb it down a little, not because, not saying that that audience is dumb, but because that may not be his area of interest. Right? So that is something that you have to be careful about and make sure that it is in an understandable mode. The other thing that I have noticed is most people are not interested in your methodology because they are not going to conduct that research. They are interested in your results. So here, when you're talking to an audience, you may want to elaborate a little more on the results, keep your methodology shorter. Unless the person specifically asks you what method did you use or what was the machine that you used, they are more interested in the results because as I told you, ultimately it is the applicability that is more important to them. And last but not the least, fluency, crispness, and brevity. These are invaluable because you want to get everything across. There is nothing more frustrating than someone cutting you short halfway through what you have given your sweat and blood for and go away without actually getting the entire result. So this is very, very important, right? So the fluency, the crispness with which you present is going to be of utmost importance. So this is how you would do it for an audience. So it's when it comes to poster presentation, it is slightly different for the evaluator and quite different for the audience. Do not underestimate your audience. Talk to them properly because you don't know what opportunities it might come up with. So this is my take on the oratory skills, which will make your presentation very, very effective as far as poster presentation is concerned. When it comes to oral platform presentation or lectures, maybe that is for another time, for another session. And I'm hoping Pankaj will invite me for that as well, so that we give our experience to the youngsters, because we want a whole new good crop of youngsters coming up with the same kind of skills that are expected of you in the medical field. So thank you.